everyone. This is the part 2 of the manual expression that I discussed in a previous video. So I was talking about one of my patients in our breastfeeding clinic was traveling around that time, and she was in the hotel 6 o'clock or 8 o'clock at night. She called me over the phone and she was crying on the phone. She said, "Alona, my breast is really hard. I feel like I have a fever. I am so much in pain. I don't know what to do. I don't have a pump right now. Please help me." She said she was crying on the phone. I said, calm down, okay, calm down. What happened? Why she has this engorgement? She was shopping, I'll tell you. She was shopping for like 4 hours at the mall. They were on holiday, her and her husband. No biggie. And she was wearing this purse, this cross bag. She was wearing a cross bag purse. So I'll show you how. So she was wearing this cross bag purse. Let me see, I have to. So she was doing this. She was doing this. See how the sling is cutting the circulation on my breast? When you're wearing this for 4 hours and you are not emptying your breast, yes, you get engorged. You get engorged when you do that. So take note, when you're wearing your purse, shopping around for hours, make sure you don't cut circulation of your breast because you're gonna get engorged. One more thing I'm gonna show you. When you are wearing a bra with a hard wire on the bottom, right into the side, see? It's gonna cut the circulation of your milk flow. You're gonna get engorged if you don't empty your breast for a long time. So just a hint on why some moms suffered with so much fullness in their milk and they get engorged and they're in pain and they're crying. So she called me and she said, "What should I do, Lona? What should I do?" So I said, "Is your husband there?" Believe me, people, this is the only way that she can get rid of the milk. Anyway, where's your husband? He said, he's here, he doesn't know what to do. He said, "It's okay." So I told her, lay down in bed, take off your bra. I told her, lay down in bed, ask your husband if there's any lotion in the hotel. So there's lotion. Your husband grabbed the lotion from the washroom, grabbed the lotion, lay flat in bed. So her husband did the reverse pressure softening because she was in so much pain. Now, I told her, give yourself maybe 30 minutes, get a cold towel because she was like severely engorged. So when the severeness of the engorgement goes away, use a warm towel. She said, "It's not working. I don't think it's working." She called me an hour after and she said, "Alona, it's not working. It's not really working." So I said, you know, people, I have to say this. Ask your husband to remove the milk. Ask your husband to remove the milk. And she said, "Are you kidding me?" We need to remove the milk, people. There is no pump. She is trying hard to remove the milk. Her husband did. Her husband removed the milk. So there is no green-minded or dirty-minded with that because she was in that situation that she needed to relieve that pain and release that milk and get rid of that milk, or else they won't go home until the next day and she's gonna be so much engorged. She said she feel like she's having a fever and stuff like that. Now, that is manual expression, okay? Either you're gonna have the help of your husband or do it yourself. But be careful when you're doing it, okay? If it's too much pain, use the warm or cold compress, whatever you feel comfortable with. Now for pumping, how often are you pumping? If you're exclusively pumping, then you have to pump every 2 or 3 hours, okay? 15 to 20 minutes each pumping session. And the best way to pump is most mothers' mistake. They rely on the machine. People, they're just machine. When you pump for better result, as the machine is going, massage the breast at the same time. Do each side. You can ask your husband to do it. Figure out, imagine how to milk a cow. You have the pump at the same time, you're also massaging it. So do it. It's a lot of work. Yes, yes, yes. You have the pump. At the same time, you're going to do your hand. But if you have your husband with you, make use of them, okay? Again, as I said, breastfeeding is a teamwork, not just the baby, not just you. The husband is there. So again, when there is pleasure, there's more oxytocin. So when there's lots of oxytocin, you got lots of milk. You got lots of input. Now, where are you going to put your milk? Based on research, people, mothers, the best storage container to store your milk is a glass, a jar, a glass, whatever you have, because it's less contamination. But nowadays, there's so many plastic containers, storage containers, you can put the labels on. Whatever you use, make sure you practice, maintain good hand hygiene, okay? Hand washing, sterilizing your jars. Do not reuse Ziploc bags or whatever. Make sure you label it, the date, the time. Now, teaching you how to store your milk. Your express milk, if you're expressing your milk right now, we put it in a bottle. It's good for 4 hours, room temperature. It's good. If you feed the baby within 2 hours and you still have some left over, you can still put it in the fridge, which is good for 4 or 6 days. If the baby's older, you can store it up to 6 days. If the baby's younger, 4 days. Some healthcare providers would say 2 days, 4 days. Listen, people, when you smell it, speaking of smell, after a few days, the smell of your milk will change because of the lactase. That's the content of your milk changes when it goes into the fridge. So do not panic if the smell of your milk changes, okay? As long as you have the date label on it, okay? So you can put in the freezer 6 to 12 months, okay? Now remember, if you thaw out your milk, meaning you defrost it, you need to use it within 24 hours, okay? You thaw it out, you thaw it in the fridge, or you thaw it out in the room temperature, but you need to make sure you use it within 24 hours, okay? What else should I tell you? Storing is, that's what I told you. Labeling, make sure you put the date on it. And what else? If there is power shortage, do not open your freezer if you don't need to, okay? You need to have backup. When you store it, you need to store it in a separate compartment of your freezer, okay? So that it will not be contaminated with your meat or whatever. So some months we store it in a separate freezer. If you can afford it, go for it. Now, when you buy a pump, you need to get a good pump because there's so many pumps out there that doesn't have a good quality of the flange. The flange, there's sizes, they're size 27, size 31, size 25, size 37, I think. 37 is the biggest. So make sure you know what's your breast size before you buy a pump. Don't just copy on somebody's friend of yours who bought a pump, which is not the same size as your breast. Again, every breast is different and every woman is different. So check your own size and what size do you need, okay? The flange should cover right even above your areola. So if you have the pump, the flange, it should cover your whole areola. If you can see it, not a small one, okay? So I think that's it. You know how to store now. You know how to pump. You know how to manually massage your breast. And if there's other things that you can suggest to me, put your comment in there. Please subscribe my channel and do the notification button. I'll see you again in some videos that I'm gonna do, probably talking about everything about breastfeeding or education or how to discipline your kid or how to raise your kid or how to change diapers and stuff like that. Tell me what you want me to talk about and I would gladly appreciate your suggestion. Bye for now.